Hi, my name's Sam Graci. I'm a Canadian nutritional and lifestyle researcher. I am the formulator and developer of the award-winning food powder Greens Plus. When I was working with teens at high risk, these teens, and many teens matter of fact, will not eat fruit in front of their peers. They won't eat vegetables or salads. They just don't consider it to be really cool, let's say. So we studied and we looked at the composition of the diet of teens who had learning disabilities, teens who had a chip in their shoulder, teens who had lost their self-esteem, teens who were depressed. And what we discovered was that they had a lot of nutrients that were missing in their brain that would allow for transmission of impulses in real time over secure lines. So a lot of messages were garbled, which meant they were antisocial, they didn't know how to communicate properly, they didn't understand the language, the rules or the regulations, so they appeared to violate them. But the truth is, they're nutrient deficient. So when working with these teens, I began to work with different psychiatrists from different universities across Canada, looking at what is the exact composition that would work best for the brain. So Dr. Hoffer, who was at the University of Saskatchewan at the time when I first began, was really concerned with the number of drugs he was given to people who were just simply depressed. And he was wondering if there was a nutrient deficiency. At the same time, I was discovering that. He was discovering a nutrient deficiency in most of what we had called depressions or loss of self-esteem or moodiness or bluesiness or whatever extension of that we might feel. So it wouldn't be so much that it was a psychiatric order that required medication. It was really trying to get food into the system and get the nutrients into the brain or into the nervous system so that they could really operate at optimum. So I was looking at how could we possibly get salads and fruits and vegetables into these teens at high risk, or matter of fact, into many adults who themselves don't eat fruits and vegetables or salad each day. So I developed Greens Plus, working with many other researchers. Dr. Linus Pauling contributed to that, Dr. Hoffer contributed to that, and we looked at growing 23 organic products around the world, drying them and putting them together to get a huge nutrient profile, getting all the phytonutrients, antioxidants, alkalinity, the equivalent of 1 tablespoon of Greens Plus, which costs between $1 and $1.50, you get the equivalent of 6 large organic salads or 6 large servings of vegetables. When you think of the time it takes to purchase them, to clean them, to prepare them, and to eat them, and for $1, especially in the winter, that you can get that same amount of nutrients for 1 tablespoon of Greens Plus, that was the incentive to start this. So I would put it in smoothies so these teens wouldn't even know they're getting the equivalent of all their fruits and vegetables in 1 tablespoon of Greens Plus. I've been asked, is there proof that Greens Plus doesn't make a difference in people's health? There's several studies that are really important. I'd like to start with Dr. Heather Boone from the School of Pharmacy, University of Toronto. Dr. Heather Boone was wondering whether I and my research was authentic and whether Greens Plus was authentic. We are saying that Greens Plus increases energy, that when you take Greens Plus, it makes the body alkaline, so that you not only produce more energy, but your immune system is more capable of warding off colds and flus. We also said that when you take your Greens Plus, that you feel better. There's a strong correlation between taking Greens Plus and feeling mentally and emotionally balanced. So there's some kind of hormonal connection. So Dr. Heather Boone took Greens Plus. She did it in a double-blind placebo crossover study, the gold standard of any type of research, such as pharmaceutical research on any drugs that we know of. It's the highest standard, seldom used with nutrients. She took that standard and applied it to Greens Plus. She took 100 women in the Toronto area. Half of them were getting Greens Plus, half were getting a placebo made from rice powder, that with green natural food dye that was made to look like and smell like Greens Plus. The people that were both given it to the 100 women, and the 100 women that were taking the product had no idea if they're getting Greens Plus or not. They monitored them over a period of 6 months. The conclusion, which was printed, the study is also available from genuinehealth.com, is that in all cases, energy, vitality, and wellness increased dramatically. The incidence of colds and flus diminished, and there was a strong movement towards emotional, psychological, and mental well-being. Well, we were able to put that on our bottle. In a sense, it was the first real clinical proof that Greens Plus really worked. Now the schools of pharmacy teach pharmacists that are coming through that one of the few nutritional products that really have proven true is Greens Plus. So pharmacists are very strong on promoting Greens Plus. But I'd like to go on a little more. Dr. Venkat Rao, PhD, University of Toronto Faculty of Medicine, Professor Emeritus, 30 years at the University of Toronto Faculty of Medicine, wanted to see if Greens Plus not only would be absorbed, but would it actually get into the cells of the body? This is the standard. It is no longer what we eat, it's no longer what we digest, and it's no longer what we even absorb. When you take a supplement, when you eat a food, do the nutrients get into the billions of little cells in our body where they're needed to function, to do some job, to uplift, to support our life force? What Dr. Venkat Rao found were the phytonutrients that ward off disease, the antioxidants that protect cells from aging, protect them from wearing out, that the vitamins, that the minerals actually not only got into all the cells of the body at an accelerated rate, to use his words, at an accelerated rate, but they also got into the liver at huge amounts that caused the liver to make two ingredients that we'd like to take supplements for. They're so important, but you can't absorb them: superoxide dismutase and glutathione. These are unusual names, but these are huge molecular, what would I say, dump trucks. They take waste products out of the body. It is as important to eat good nutrients, to bring them into the body. Then, as they break down, we have to get the waste products out of the body. It's a continual turnover. The more efficient that turnover, the better we are. So Greens Plus was shown not only to get an enormous amount of nutrients into the cells of the body, clinical proof from the University of Toronto, more than any other green drink they've ever looked at or supplement, but more importantly, the amount of glutathione and superoxide dismutase that were formed, especially glutathione, that was the main marker, were capable of taking a lot of waste products out of the body. The last one I'd like to mention about Greens Plus was the University of Eastern Michigan. The University of Eastern Michigan took some of its prime athletes between the age of 19 to 22, perhaps, that age group. They had them sit on a stationary bicycle and exercise until total exhaustion. When they were given Greens Plus, they could work out much longer until total exhaustion than when they were not given Greens Plus, when they were given a placebo. Their diets were kept constant, their nutrients were kept constant, their supplements were kept constant. It was just the addition of Greens Plus. These are already prime, efficient athletes, but they were able to extend the rate at which they could work at their optimum longer. So then the researchers felt that the antioxidants and phytonutrients, the vitamins and minerals of Greens Plus were getting into the mitochondria. Those are the little cells that produce our energy. There are hundreds of them in every cell of the body. They're organelles. They make energy called ATP. You might have heard that name, adenosine triphosphate. What they found was Greens Plus did not just get into the cell, they got into the mitochondria. Very difficult to get something in the mitochondria. And where our energy is produced caused that mitochondria to produce more energy by protecting it from wear and tear, so it could produce more energy before it became exhausted, needed to be recharged with new nutrients.